Almost all of our patients right now are on ventilators. They're requiring life support because of the damage that COVID has done to their lungs and their whole body. But also emotionally, it's hard. We're seeing so much more death than we're ever used to seeing. So trying so hard not to take that home with us every day has been a challenge.
For critical care nurses, it's very hard because we like to have control at all times. So, you know, we have our IV poles outside of the rooms. That's how we're giving medications to a patient through an IV. So that way that limits. Or our ventilators, our control to the ventilator, it's also outside of the room. That's how we're making changes and adjusting things to see how a patient can handle it or not handle the changes being made. So that's a huge thing for us and a learning curve that we had to adjust to.
They can't have their family at their bedside holding their hands. We're not able to sit down with them and just connect with them as a person like we're used to doing because we're trying to cluster that care to protect ourselves. It really was such a roller coaster. Some of the lowest loads that we've seen, holding that iPad, grieving with families as they're saying goodbye to their loved ones through a screen. Fast forward a couple of months, we're rejoicing, we're hopeful, we have a vaccine. We can prevent other people from going through this kind of a tragedy. It's a total roller coaster.
But once the vaccine came out, our numbers started declining rapidly. And I can remember talking to somebody, I'm like, gosh, that seems like a lifetime ago, because, you know, we are affected from that. But what a blessing that we have this vaccine and we weren't seeing the numbers anymore. So yeah, it was a huge relief that we didn't have to relive this again. And maybe that was the answer. And for me, that was enough.
I don't think we've ever had this many critical care patients, much less critical care COVID patients. We don't have enough nurses to keep up with that, and we are losing the ability to provide safe care. I'm concerned that we will get to a point where we will not have enough ventilators or enough supplies for everybody, and that's a nightmare.
I think that we had, you know, enough, but it was definitely a conversation if we did get to ends with ventilators. But you know, not only ventilators, we have the vapotherms and the BiPAPs. Those are things that we use to keep people off of ventilators. And I know for sure that we were towards the end of our supply in that.
People are still having emergencies. People need us to be there, and we're, through all of this, still going to continue to show up for them because that's what we took an oath to do.
I'm showing up for patients, I'm showing up for my colleagues, and I'm showing up for our leadership. And that's what, to me, is most important, is to show up and be there and be present.